Thank you for inviting me to the workshop on healthy living. My name is Mohammad. I'm the CEO and founder of Patients Know Best. I'm basically a geek. I trained as a physician and programmer, and I wrote 6 books about using IT in healthcare. One of them was how do you share medical records with patients? And I became particularly obsessed with the problem because I have a genetic immune deficiency myself. So I thought back to all my appointments when my physicians rely on me. I tell them what the other physicians did, and I give them advice on how they treat me. And I realized they trust me with my treatment, not because I went to medical school, but because, like all patients, I went to all the appointments. And so as I wrote the book about giving patients access to their record, I realized how many situations I could improve the quality of the consultation for myself and improve the ability of my physicians to help me and to look after me. This is not just a problem for rare diseases. It happens in every situation, for every patient, in every health geography. Different people try and solve this in different ways. Some take an institutional approach, some take a disease-based approach, some try and do it with apps and devices. The problem is healthcare continues to get more fragmented, and that's before we even think of the patient themselves as a provider of care. So the approach that we take is that all the data about the patient goes in one place. That's a record owned by the patient, and the patient makes the data available through the correct consent to every provider looking after the patient. We started in 2008. Right now we're the largest personal health records company in Europe, and we have contracts covering 20% of England. 12 million lives are covered through our system. And it's the system that's recommended to hospitals in England by the NHS Innovation Technology Payments Programme. Now, what does this mean in practice? The heart of this is the ability of the system to give the patient consent. The patient decides which part of the records to open up to which medical professionals, like the general, the sexual, the mental, and the social care data. And the patient opens up maybe everything to their general practitioner, and maybe it's only some things to their physiotherapist, for example. Then you can start getting the benefits of the patients working in digital fashion. So if you send them letters, they look at the data. About 70% of them look at letters within 48 hours. About 50% of them see it within 2 hours. That means you can avoid postage, but it's not just avoiding £1 in postage for the appointment, it's avoiding the appointment for £100 or preventing the A&E admission for £1,000. Then you can start doing things with patients. This is the sexual health clinic in Plymouth. They made the messaging system available to patients during lockdown. The power of secure messaging across providers is that you get the security, so you don't have photographs of sexual health images on a physician's phone if they're using WhatsApp or email, for example. You get the safety, knowing that it's not stuck in one clinician's inbox, actually available to everyone in the team looking after the patient. And you get the accuracy. The photographs you take are actually much better than trying to do a screenshot during a video call. The patient has enough time to take the right photograph, they get the right lighting, and they give you what you need to make a diagnosis for the patient. You can also give test results to patients. This is Paul, he's a patient in northwest London, and he gets his HIV test results. As you know, most patients are stable with HIV. They may get 3 appointments a year. They only need 1 to actually do the physical examination. And the rest, they're just asking, what's my CD4 count? Now, if you can give them that information without them coming in, many of them are working age, they don't want to take half a day off work for a 10-minute appointment. And if you can give them that real time, that's more convenient for them, but also increase the safety of care as they go abroad and they travel with their information. This is Reston. He then used the system he's a surgeon who used the system for care planning for severe trauma patients. The care planning functionality is really powerful because you can actually embed videos, websites, explanations, video of how to use an inhaler, how to wash a spacer, how to inject yourself with medications, and then instructions on what to do in different situations, what to do when things are going well, what to do when things are going badly, and when to escalate and come to A&E. Now, this actually works in practice at large scale. So we have the records of patients across the UK in every county with hospitals in most regions in the UK. But it all started really in 2015 with Imperial. This is John Kelly from Imperial, who led for northwest London, putting the patients in control over a population of 2.3 million people, 400 GP surgeries, 16 hospitals. This was the first time in the world that all the medical data was placed in the hands of patients and they could decide who gets access. Now, that solved all the information governance problems, and you can then deliver better care. Next year in Wales, this is Sam talking about her father and how he gets his test results, and that lets her look after him. This was part of a national integration in Wales where the data comes for patients in Wales or being looked after by a Welsh provider. And then it spread internationally. This is Lucian in the Netherlands. He led on chronic myeloid leukemia, the national standard being patients know best. Really, this is about delivering something across entire large geographies. What came out in March of this year was the NHS app integrating with Patients Know Best. As you know, the NHS app in England gives patients access to some of their GP data. PKB gives access to all of the data from the NHS, including hospitals, test results, but it also gives the patient the ability to put in their own data, so their symptoms, their home devices. They can do shared care planning with the patients. And that's why even the disease-based approaches have switched to using PKB. This is the renal portal in 72 hospitals. They've all switched to using Patients Know Best. I'll stop there. If you'd like more information, please visit our website. Thank you for watching this presentation.